Hello, and welcome to another case presentation in the field of leg lengthening. Today, I would like to present to you a classic case with a standard course in the thigh area. I will show you the app's backend with the displayed lengthening speed and the patient's pain level. At the same time, I will show you the X-rays at intervals and the corresponding gait pattern during or after the lengthening, so that you can get a good impression of the entire process and the timeline. Let's start with the X-ray before the surgery. I always require full leg standing images in advance. Based on the images, the measurements are taken and the corresponding lengths of the thigh or lower leg are entered into the app so that the proportions can be constantly monitored during the lengthening. A clinical examination of the patient is also conducted in advance. This serves to evaluate flexibility and to uncover muscular deficits. The X-ray and the clinical examination were normal for this patient without any abnormalities. The patient had a good plan and extended the regular stay in rehabilitation by 2 weeks. Afterwards, he completed the rest of the lengthening at home and was able to continue his work regularly during the lengthening. As long as one avoids sitting activities, this is also possible without any issues. Here you see the first days of the lengthening. In general, we start with the thigh lengthening approximately 6 days after the operation. The columns reflect the number of clicks. 10 clicks mean 0.5 mm lengthening per day, 20 clicks would be 1 mm per day. Initially, we start with a few more clicks, and then continuously reduce the number of clicks. Additionally, you can see the difference between random clicks and regularly performed clicks. Random clicks are orange. Regularly performed clicks on the right side are light blue. On the left side, they are dark blue. The blue fields next to the clicks indicate the time required to perform the clicking. Each block corresponds to 8 minutes. Furthermore, you can see the pain level as a blue line for the right side. Pink is the left side. The patient started with a moderate speed within the first 8 days. He had a random click on the left side on day 2. The pain level was initially at 1 out of 10. 1 out of 10 means no pain. After a few days, the pain level then slowly increased to a range of 3 out of 10. This is also quite expected as the muscular tension increases and becomes noticeable during clicking. The time he needed for clicking was under 10 minutes for both sides each day. The next point that shows a significant change for thigh extension patients is the end of the tension phase. This usually occurs at 3.5 to 4.5 cm. This corresponds to approximately 5 to 7 weeks after the operation. We can also track this very well over time here. The patient consistently made 12 clicks every day, which corresponds to 0.6 mm per day. The time required for clicking remained low and the pain level decreased from level 3.4 to 1. It also remains there until the end of the extension. This is the classic course for patients undergoing thigh lengthening. The tension phase is the difficult period between 1.5 and approximately 4,5. During this time, significant muscular pain can indeed occur. Once you have found your balance and can regularly perform your stretching exercises, the pain level decreases to a low level. The basic prerequisite for this, of course, is that you also do your stretching exercises. This should generally be between 2 and 3 hours daily. Here you can see the set time intervals. From about 80%, the bar turns green. You also see the stretching of the individual areas distributed over the day. Therapeutically, it would always be the best situation if you are in the green area, and accordingly you benefit well from muscular flexibility. The stretching exercises were further individualized and adjusted to the respective areas that bear higher tension. We have divided our stretching program into 5 areas, with the main focus on the hip flexors and the lateral area, as these areas cause the most tension in the context of thigh extension. If we now look at the X-rays and the corresponding gait images, we have this X-ray over time. At about 3 mm, you can see that the implants are sitting very stably with no signs of bending or loosening. and you can see a nice callus cloud on both sides which limits the extension gap. The corresponding gait video at about 5.6 Simitlan shows a good and clean gait pattern, forearm crutches, without muscular deficits. Even with reversed forearm crutches, a stable gait pattern is evident. The legs can still be closed well. With free walking, the swinging of the upper body is naturally visible, but it is very well compensated. The gait is still small-stepped, but all of this is completely normal. At this stage of the extension, it is also important that the pelvis can still be held upright without tilting forward. In this phase of the extension, one should aim for about 5,000 steps daily. This also further induces bone growth. The next X-ray at about 6.5 Simitra shows an unchanged implant position. The callus cloud nicely follows the extension. Sometimes you see a tearing of the callus cloud. Then the regeneration is not as fast as the distraction. In this case, however, it can keep up very well. As the process continues, the gait pattern remains practically unchanged. This video is at 9.5 cm extension in the thigh area. The legs can still be nicely closed. No muscular misalignments. A stable situation is evident. The final X-ray after the completed extension shows continued good callus formation with proper implant positioning without loosening. Here, a rapid regeneration of the bony structures and thus a stable gait pattern is to be expected. We also see this in the next gait video, 12 weeks after stopping the extension. The gait is normal again. The short-stepped gait has disappeared. The speed has normalized, and the tension has significantly reduced.